a certain number of biofeedback treatments, which wasn't before available. I think it's a great time to be doing that biofeedback, because it's only been available through Medicare for the past year or so. Before that, patients had to pay for it on their own. But again, I think that's an excellent thing to go along with the Kegel exercise. And the physical therapist will do not only Kegel exercises, but also what we call E-stim, when they put the little cone inside the vagina and they can stimulate the correct muscles that you're using so that it's not painful, it doesn't hurt. It's just like a little twinge. It says, oh, you know, those are the muscles I'm supposed to be using. So I find that they're very helpful, and the people that I've sent for physical therapy have been very happy. And it can help with fecal incontinence or the stool incontinence, pelvic pain, all different types of things. Biofeedback can help, so I think it's an excellent idea. Okay, intraurethral plugs, I haven't had much experience with. They're little devices that are inserted into the urethra. They came out probably 5 to 10 years ago, something like that. They're little plastic devices that are inserted into the urethra. You have to do it yourself. A little balloon inflates, I believe, and then you remove the device when you're done. It sounds uncomfortable, it sounds painful, and most people don't like the idea, and they haven't had much success with them from what I understand. I don't know many people who are using them. Pessary is a little plastic device. It's about this big around. It goes inside the vagina. It'll usually have a little knob on one end that pushes up against the urethra and gives you a little extra support so that it can help push up on the urethra a little and give you extra support so you have less leakage. There are also types that you can insert that inflate into big donuts. And so for young women who are active and just need extra help while they're out playing tennis or whatever, that's a great idea as well. And you're not supposed to be at any higher risk of developing bladder infections or vaginal infections when they're taken care of appropriately. But they're all different types of pessaries that you can discuss with your gynecologist or your urologist, depending on where you are. The next option, if none of these things are working so far, or if these ideas don't sound good to the patient, the next thing is something called collagen injections. The same type of collagen that we inject into the face or for cosmetic reasons can be injected through a little camera into the bladder neck. You take the little camera, look in the bladder, inject a little numbing medicine first. It can be done in the office. Some people do it in the office. Some people do it in the operating room for extra anesthesia. And it's a little collagen that can be injected. 25% of the people will have complete cure after injection of this material. 50% will have significant improvement, and 25% will get no relief at all. That's great, but the problem is, as you know, collagen doesn't last forever. And in an average from 2 to 12 months, it'll completely go away, and you'll have to come back and get booster shots. And again, the first time you come, you might need to have more than one injection to get your maximal continence. But that's definitely an option that's available that I don't think a lot of people are aware of. That is good for people who don't want to have the bigger surgeries, but yet haven't had any success with these other things, or they know themselves and know that they're not going to do these exercises. It's definitely a possibility. The next thing is transvaginal surgery. Things that can be done through the vagina without any cuts on the abdomen or any incisions on the abdomen. It depends on what type of material you use. There are synthetic tissues or synthetic plastic types of tapes that can be used. There are cadaveric tissues, meaning tissue donated from other people that can be used. And there's always your own tissue that can be harvested from your belly. And what it is, it's a small strip of tissue. It's about this big or so. And it's put in through the vagina. A small opening on the vaginal wall is made. The strip is inserted into the vagina, and a string is inserted up toward the belly button used to hold it up. And that actually supports the urethra or picks up the urethra. And with time, the urethra will scar up a little bit higher than it was before. And it's supposed to be a permanent cure in most people. I'd say it's about a 75 to 85% complete success rate in 5 years, depending on what type of tissue you use. There are all types of tissue that can be used. Again, synthetics, they're good in that you don't need as much anesthesia, but I don't have a lot of experience in that because there can be disastrous complications, and when you do have the complications, they're very difficult to deal with. So I don't do them myself, but I know that there are people that have more experience with them that feel very comfortable with that. But again, I don't feel comfortable doing them because I'm just a little worried about what could happen if there are any problems. The next, again, tissue donated from someone else. You might worry that there might be HIV